Good evening, everybody. Welcome to another episode of Libertarian Party TV, our weekly town halls on Thursday, where we connect with you, our members, to talk about various issues that have come up during this crisis and talk about a way that libertarians can provide a different perspective and take advantage of some of the opportunities we have. You know, there's a lot of focus in the media on how the crisis has been causing a lot of damage, a lot of economic dislocation. But what we wanted to focus on tonight are the opportunities for libertarian solutions that talk not so much about how we get through the crisis, although that's important too, but what we come out the other end with, whether or not we come out with something better and more freedom and more economic opportunity and more growth and more opportunities for personal empowerment and the pursuit of happiness, or if we let the other parties push us into having more regulation, more limits, more government control. So tonight, I'm very excited to be joined by a couple of different guests who are titans in the licensing reform movement. And our first guest this evening is Shoshana Weissman from the R Street Institute.
Thanks for having me.
I think we may have lost Nick there for a second. So I'm going to jump in real quick and let's see. Shoshana, tell us a little bit about your background with licensing and some of the things that you think going forward right now, you see opportunities where licensing and regulation are getting in the way of an American economic recovery.
Sure. So I've been into licensing for quite a long time now, embarrassingly long time. I learned about the issue when I was about 20 after getting into the legal theory that kind of shows why we should uphold the right to work. And that means that licensing laws need to make sense. So the first story that really got me into it was Sandy Meadows. She was a florist in Louisiana who wasn't allowed to be a florist. She was an elderly widow who had never had to provide for herself before. And her first attempt, she wanted to be a florist. So she tried taking the exam and she couldn't pass because the pass rate was lower than the Louisiana bar exam. She's an Institute for Justice client, and when she went to work for a grocery, the state government cracked down on her, saying, "No, you can't do that. You can't hire her." And well, she had worked there for a while, but the government basically said you have to let her go. So they had to, so that they wouldn't be shut down. And when she ended up dying, she was in poverty because government wouldn't let her do the thing that she knew how to do. So that was the first story that got me into licensing reform. But since then, it's just been really realizing how many things are licensed that shouldn't be. And, you know, licensing sounds like some big nerdy word, but it just means that government's telling you you can't do a thing. You can't make a living in the way you want to. And sometimes that's okay, in my opinion. Like if you have a doctor who doesn't have a license, there are actually bad stories of like unlicensed doctors in America, but you never really hear about like an unlicensed hair braider who's causing lots of harm or an unlicensed florist. So regulations have to make sense. And it was those kind of things that got me into it to start with. But over the past couple of years, I've really gotten into bigger parts of it, like why people can't practice their professions across state lines. You know, a doctor in Arizona should be allowed to practice in Colorado. And I think of those two states offhand because they've been really good with licensing reform. Last year, Arizona became the first state to allow people to transfer in their licenses when they moved there. It's not a perfect law, but it's really good, and it's something that more states should be doing. But when he passed it, I don't think Governor Ducey down there had realized the significance it would have at a time like this when you need medical professionals to go where they're needed. So states like Washington, Louisiana, and New York in particular are facing really high rates of coronavirus. So in the first few weeks of this, you saw the governors in those states say, hey, if you're licensed to practice in America, you can come practice here, and allowing nurses to do a little bit more in a lot of cases. In too many states, nurses aren't allowed to do everything they're trained to do, and they have to always work under a doctor, even when it doesn't make any sense. So in all of these cases, you're seeing, you know, so I think one thing to know is that in the licensing reform movement, you always have people going after occupations where it's just silly to have a license, like florists and hair braiders, and hair blow dryers are licensed everywhere but 2 states. But the current pandemic has shown people that it's not just those that matter. Of course they do, but it's also the more professionalized professions, whether it's medicine, pharmacy. So all those have had wild amounts of reform in the past couple of weeks in a way that you might not have expected to see, or I certainly didn't expect to see even a couple of weeks ago.
Yeah, interior design. When I clerked at the Institute for Justice, we were actually working on Texas, where they were trying to get a license, or they were trying to maintain a licensing system for interior designers. And it always had these far-fetched examples that they would bring in their court pleadings, where they would talk about, if an interior designer put the wrong kind of curtains that were made out of some sort of highly flammable material, it might burn down your house. But they had to make up bizarre hypotheticals in order to get something there. I think what you see a lot of in professions like law and medicine and pharmacy is there's a sense that these are such important things that it would be, chaos and danger and death and destruction if there was any relaxation of the licensing requirements. But the odd part about this current situation is these are the most important professions during an infectious pandemic, and those are the first regulations to go. And we're not seeing a lot of bad medicine being practiced. We're not seeing, people going in and causing more problems than they're solving. And I guess it raises a question is, are some of these regulations, are they really about health and safety, or are they about making a profession or a trade into something that's very hard for other people to compete with or to get into, so that the people in there can make more money either at the corporate level with the healthcare system, or at the practitioner level with a doctor or a dentist or something like that?
Oh, yeah. And no matter what profession is licensed, the claim is always health and safety. Just like you're saying, with Louisiana floristry, there were claims of infected dirt. Like, what would it be infected with? So no matter what the profession, that's always the claim. But evidence rarely, if ever, backs that up. And part of the struggle is that you have to prove a negative. You have to prove, nothing bad will happen if these regulations are relaxed. And in a lot of states, and in a lot of cases, both with lower level and higher level professions, you have evidence to show that it's fine. Every state except Louisiana doesn't have a license for floristry, and it works great. And about half the country requires nurses to have a very narrow scope of practice, where they have to always work under a doctor, and they always have to they're more restricted in what they're able to do in their testing and other things. But in the states where there's a broader scope of practice, you see medical costs go down, more access to care. So there was already proof that stuff was working, which is, I think, part of why you saw those regulations being relaxed in so many cases. And the evidence was always on their side, whether it's allowing pharmacists to refill prescriptions a little bit more to make that a little bit easier, whether it's allowing doctors to work across state lines. There's as someone had mentioned, there's a medical compact that allows nurses to work in a bunch of states, but not all states, which still makes that pretty difficult. And with doctors working across state lines, people are people. It's not like they have different internal organs from in one state or the other. And it's silly. But I think one thing that really gets me is that politicians are always a little bit more open to the lower level reforms. But when the stakes are higher, then the stakes of the reforms are higher too. And the fact that they were so willing to waive them and to open things up, allow doctors to practice telemedicine from different places, as opposed to forcing them to be licensed in either the state in which the patient is located or in which the telemedicine platform is located. All those restrictions being waived so quickly showed that they kind of realized that those things would help. They didn't do it to make things worse. They did it to make things better. And the fact that they were first of mind kind of shows you that they knew these things would work. And unfortunately, a lot of times it's lobbies or even just concerns of what people will say. Whenever you reform a regulation, you have to worry about the people saying, "Oh, I knew this bad thing would happen," and there's no real political benefit for them in a lot of cases, unfortunately. So it's been heartening to see, and it's not really red states or blue states doing it. It's everyone, and it's the good and bad you see is split fairly evenly, which is kind of a nice bit of nonpartisanship at a time when things aren't so great.
Yeah, I think one of the things that just structurally we're learning more in this crisis is that government by its nature is not really capable of doing things. It's only capable of slowing things down or putting barriers or rules up against doing things. And the most sort of critical place where that regulation that was pitched as for health and safety has hurt us so much is not licensing per se, or at least not for practicing a profession, but the nature of licensing for medical testing and devices that has held back rapid testing and home testing for COVID-19 or COVID-19 antibodies. And the FDA's job is to slow things down. That at their best, that is what the FDA does. And all they've done that's been beneficial during this pandemic is every time they remove a barrier, they allow something to go through without the normal procedures, lives are saved. And I think one of the things, I mean, are you seeing a shift where you think policymakers, either at the executive or at the legislative level, are they internalizing this lesson, or are we going to need to work harder to help them understand that this is health and safety is actually improved by having less regulations, not more?
You're definitely seeing some people realize it. I can't remember offhand, but I think it was Washington and Oregon. I saw some big deregulations that I was surprised about. They're not exactly known for that kind of stuff. While Governor Ducey in Arizona and Governor Polis in Colorado really understand deregulation, not everyone does, but I do think you're getting to the point where people are starting to understand how it works a little bit more. And I kind of understand the difficulty because politicians can't do everything, and they might not be focusing on that area, and they might not fully understand how regulations get in the way of things. But I think what's brought it so much to light is, as you're saying, all the FDA getting in the way of expanding testing, and all the state deregulation too. A lot of people didn't realize that you couldn't practice telemedicine over certain platforms because of federal regulations. They didn't realize that doctors couldn't work across state lines. If you're not a licensed professional, you don't really think about those things, especially if you're not licensed in that specific area. So you're definitely seeing people internalize the lessons, but the good's not going to happen overnight. You're going to have some of these regulations go away forever through the legislatures, as they should, not through executive orders, because you don't want anything to be waved in or out as people wish, permanently at least. But I think in a lot of cases, you're still going to have the lobbies come back and say, well, we still want these things. But I think it's going to be a lot easier as far as knowing that the public might be behind them, realizing that the suspension of certain regulations helped at this time, and that maybe it's time to do away with them forever. So there's definitely a lot of good to come of this, at least as far as expanding access to care going forward. But I still think it's always going to be a battle. You're always fighting the people who want these things to stay.
Are you seeing it at the public level? Are people seeing that, if you allow alcohol to be delivered by takeout, right, from a restaurant, or you allow more healthcare workers to practice across state lines or come into a state to meet a crisis and fewer neighbors die, are the people positive about it? And do you think that may be the solution to getting some of these things to be permanent?
Yeah, I've seen literally zero public pushback to any of this stuff, which is really surprising to me because I'm so used to being told, oh, you don't really care about health or safety, even when I have the data and evidence behind me. But I'd expected to see some more pushback from people, but the public, I think, is getting it. I don't think they'll get it forever. Like, I don't think in 10 years they're going to remember all these lessons, but that's kind of why it's important to jump on it now, to say, look, these things have gotten in the way of different kinds of progress. they've stopped businesses from being able to operate, and the reforms have helped. So maybe we should consider that going forward, and showing people that flexibility and freedom are virtues in themselves. Why erring on the side of liberty is important, not as some broad construct like, oh, yay, liberty, but because allowing people more liberty and flexibility that's a big deal in hard times. And right now, the whole country is going through a really hard time with coronavirus, but individuals go through hardship all the time, and policies can't address every individual in that same way. They can't always provide those perfect exemptions. There's ways to build that into law, but law is still going to always forget about some people. Especially when laws aren't protecting people while they're purporting to, those can do a lot of harm in ways that I think people are starting to understand. Wait, why was this even here to begin with?
Yeah. Well, thank you, Shoshana. I want to bring in now Laura Ebke, former state senator and senior fellow at the Platt Institute in Nebraska. Laura, how are you doing?
I'm doing well, Nick. Thanks for having me.
So you're in the trenches day to day at the policy level, working with former legislators, working with legislators across the country on the nuts and bolts of changing job licensing. And you were a pioneer in getting licensing reform done in Nebraska long before we had any sort of crisis spurring it on. What's been your experience both before this crisis, moving into the policy arena, and how has it become different now that we have the crisis?
Well, it's interesting that before the crisis, there was still a lot of the old interest groups were still kind of carrying the day. We were getting little bits and pieces of progress, aside from sort of the big moves in Arizona or Nebraska and Ohio and so forth in the last couple of years. But, as individual licenses, that didn't really make a lot of difference anymore. Things like horse massage in Nebraska, for instance. We decided that when there were no more horse masseuses in the state, that maybe we didn't need to have the license anymore. So we got rid of the license a couple of years ago. But it's interesting, as I've gone to other states and talked to people in other states, they run into the same problems. You have sort of this this trust in the past. Legislators say, well, they must have created that license for some reason. And then you have the entrenched interest groups who don't want to give up any protectionist authority over their their own occupation. And in many ways, that's really what it is. It's a protectionist scheme. You mentioned interior designers a little while ago. The interior designers came to us, the Platt Institute, a year or two ago, right after I joined up, and they asked if there was any way we could support anything that would allow them to have some sort of recognition so that they could put their stamp on building codes, because they needed to put the stamps on the building codes, because otherwise they had to go and pay an architect or an engineer $1,000 or more to put their stamp on the interior designer's design. And this is for things like doorway sizes, changing doorways, renovations a lot of times, and things like that. Well, we talked about it, and there are ways to get around it, right? There are ways to get around having an actual license, and rather just having a recognition so that they could get their stamp. So we said, let's, do you want everybody to have to get this? And they said, no, just the people who want to, do that. Some people are happy just to call themselves interior designers and tell you what color to paint your walls, or where your cabinets should be hung. And so we said, well, how about how about specialization? I said, do you get certified by your national organization? They said, well, some of us do. And I said, well, what if we said that national certification would be recognized by the state of Nebraska for purposes of giving you your own stamp? It's a private certification. All we're doing is saying, okay, this is going to be recognized, and you can take it to the take it to your city building inspector and show them the design, and you don't have to pay the architects and engineers. And they said, well, that'd be okay. Well, of course, we had the hearing on the bill, and guess who came in and opposed it? It was the architects and the engineers. So I mean, that's the kind of thing that you fight all of the time. People don't like to give up their turf. And so we're seeing a lot of that around the country. But I do think that, this notion that it's for health and safety and welfare of the public is losing some steam with this current, deregulation, even if it's temporary, environment. Because in a time of medical crisis, if you will, when health and safety truly are at stake, what we're showing is that these state licenses really don't make any difference.
Yeah, I think, this is the sort of experiment that you would have had a lot of trouble, I imagine, getting a legislature to go ahead with. Hey, how about we just let doctors come in from other states? Or, hey, how about we let nurses do a bunch more medical procedures than they used to be able to do? I imagine those hearings would be pretty dicey. But we're running that experiment because there is a crisis, there is a need. And what are you seeing on the ground in Nebraska? Are you seeing any sort of problems with it?
Well, we haven't seen any problems with it yet. Of course, Nebraska, we really haven't. We've kept our curve pretty flat, and so we haven't had the sort of. Our governor instituted the policy through executive order that we could hire from outside. That they waived a lot of the licensing requirements for some of the lower level nurses, aides, and things like that, and that's been fine, and we haven't had any problems with that. I think that we'll know more, in 6 months, if you will, after we find out whether people who went to New York and Massachusetts and Michigan and some of the other, hot spots, whether or not there were problems with those doctors and nurses that went there. I suspect that there won't be many problems, and that the folks in those hot spots will have been happy to have the volunteers come in and work there. We'll find out that, well, maybe a universal recognition of a license from one state to another. And just because you move from one state to another doesn't mean you lose your skills. And that's the thing that that's the thing that I think is really important for us to remember, that, if you're an electrician in Colorado, it doesn't mean that you learn your ability to do electrical work when you move across the border to Nebraska. But Nebraska's laws would require you to, jump through all sorts of hoops. Same way with cosmetology. Most of us have lived in a couple of states in our lives. Honestly, if you look at the differences in those different states in terms of what's required to get a cosmetology license, you wonder, okay, why am I getting a better haircut in the state that requires 1,500 more hours of education? And the answer is almost assuredly no.
Yeah, and I think, one of the things that we sometimes forget is the whole idea Bastiat had of the seen and the unseen, that, you see the licenses that are being put in place for interior designers or cosmetology or, some of these trades. But what you don't see is what other things are not being done because of the time and the effort and the regulation put in place there. And there may be regulations or there may be things that can be done to deal with this pandemic that have escaped people's notice or been unseen because of these other focuses. I know in Nebraska, you guys have a pretty serious packing industry, right?
Right. We have a number of packing plants, yeah.
And have you seen any outbreaks come from packing plants?
Yeah. It's interesting. Grand Island, which is out in the middle of the state, not a very big city, is the hot spot in the state, and it's based in the packing plants. On the other side of the border, up in Iowa, they're having a similar problem at one of their packing plants. I live in a community that has a packing plant. We're kind of holding our breaths yet to see whether or not it breaks out in a massive amount. But there are some positive cases out there, according to the public health folks. So we are most likely to see some big things happening. And the question is, could we have figured out ways early on to let those to let the power the packing plants change their procedure enough so that you minimize some of that danger. Although, in packing plant, the packing industry is, by its nature, has a lot of people involved. So.
Yeah, and I think one of the things that we're seeing is that in some of these regulations that don't really go towards health and safety that are just barriers, we're missing some regulations that theoretically could be health and safety related. You know, if you have people who are packing meat who are close together all day long every day, the nature of a virus is that it's going to spread. That's not what all of the various regulators that regulate the packing plants are looking for. They're looking for whatever the last problem was. And I think, you know, not in the professional licensing area, but, you know, we had a bunch of reusable bags because we were environmentally conscious people. And now my wife has actually been stopped from going to the Trader Joe's because you can't have your reusable bag because it spreads a virus. So I think that that sense of what the trade-offs are you seeing that discussion is coming out more now that the stakes are higher?
Yeah, I mean, I think that people are talking about this more, and you know, I've been good. I've been staying inside, so you know, my interaction with people is primarily through social media and webinars like this, and I think that, but I do think that people are talking about it more. I think that there are a lot of policy institutes in the country that are talking about it a lot more and are saying, you know, this is a real benefit for us. This is, you know, you don't want to make a benefit out of a pandemic, but it's certainly an opportunity, and it's an opportunity for us as libertarian, those with libertarian ideas, whether we are big L libertarians or not. It's a way for us to bridge that gap and to show people that, you know, government doesn't have to be involved in this. We can do it ourselves. We can be smart about things without having without having licenses and without limiting what people are able to do on their own. You know, on their own initiative. We're going to need tons of entrepreneurs to pull us out of whatever this economic mess is going to be in the next 6 months to a year to 2 years, or whatever it ends up being. And I think that you know, we need to unleash that potential and not stand in the way of people having the opportunity to thrive and to experiment with, you know, new things in their lives.
Yeah, I think, you know, this would be a good time to bring Shoshana back into the conversation so we can have a little more dialogue about, you know, one of the examples that's been brought up before for ways to think about this is other disasters, not infectious disease, but kind of the difference between what happened in Galveston after Hurricane Ike, where any contractor from anywhere could come in and work to rebuild the devastation from the hurricane, compared to what happened after Superstorm Sandy in New Jersey, where it took a long time to rebuild because nobody was allowed to do any of the rebuilding if they didn't have the appropriate New Jersey contractor license. What sort of lessons do you think we can take from those different responses in this current situation?
Well, and I'll jump in here. I think that it's certainly, and Shoshana can follow up and correct me where I'm wrong, but I think that it's certainly the case that the more universal we let our licenses be, the more reciprocity or recognition or whatever that we allow, the more nimble that the market can be. If there is a demand for, you know, for construction workers, they can go easily and don't have to worry about licensing. If there's a demand for healthcare workers, they can go easily and don't have to worry about licensing. So the more we recognize in the states that that it is to our benefit to be nimble and to recognize the licenses of others. Is a good thing, I think.
I totally agree. Except the only point where I disagree is that I could never correct Laura.
That's okay. Go ahead.
No, but that's the point on which I disagree. No, Laura's done such incredible work in the licensing movement, so I'm excited to be on with her. But I'd add there too that that in addition to everything she had said, there's so many other regulations that are kind of licensing adjacent, like certificate of need laws, where you need permission from the government in order to like add hospital beds and add new medical facilities. So nimbleness in just every possible regulatory way, obviously within reason, but there's so much there's so many areas where we can fix stuff. Doing it on the fly isn't bad, but it's better to do it beforehand, which is why Arizona benefits from having the reciprocity law, so that they have a model to adapt. In California, they have a legislation, actually a law now, where if you've been displaced by a natural disaster, then boards are allowed to waive your licensing fees. And there's other pieces of legislation across the country to that effect, but more of that, more just flexibility in general, and then maybe special exceptions during certain occasions. And even, you know, the government also subsidizes people to live in floodplains, and maybe that's not a great idea for floods. There's so many regulations that have unintended consequences like that, or that just stop people from being able to do the things they need to do. Even with one thing I'll add too is just with certificate of need laws, it's helped as far as hospital beds, because if you say, hey, now you can add more beds, that's something they can take care of fairly quickly. But adding new medical facilities or new medical practices isn't going to be something very easy to do on the fly. That takes a lot of time, a lot of investment. So it would have been better if they had waived those laws far earlier. And there's so many other examples of that, where you need to give people flexibility generally, and then maybe put into place how you're going to handle it down the line. One really good example of a failure in a couple of localities, to my knowledge, in New Jersey and New York, they were still giving out parking tickets while people were being responsible and staying inside. We had advocated at my organization just waiving some of those laws, allowing people to park for long periods of time so that they're not risking spreading the infection by going outside. So making sure that not only are you doing those things, but you have the plans to do those things before, and you've thought that stuff out. I think you're going to see some of that now, especially when people realize that doing things on the fly isn't the best way. But I can't stress enough that just having those plans in place and understanding the virtue of flexibility in good times and bad.
You know, it's interesting. I thought I'd just toss in here. There's a conversation going on about being careful about what we do with licenses, you know, not nationalizing them. I'm not for nationalizing licenses at all. Actually, I think we need to get rid of most of our licenses in every state. But that being said, you know, somebody brought up the point about building codes. Well, yes, there are some variations in building codes around the country, but most of them are based on the national code, and then the states have their own codes that are usually based on the national code. So, you know, I would suggest that that's not really that tough, and that's easily enough fixed, because you have officials in every community who are designated as the building inspector, and they can certainly make sure that the codes are being enforced. And I think it's one of the things that, rather than limiting the worker, we need to put the focus on the state, if you will, to ensure that the codes are being adhered to. There's a lot of people who go out and build foundations, or put up 2x4s and build walls and houses and things like that, but they don't do it because they're not licensed. And maybe what we need to do is let the people who are willing to work and have the building inspectors come out and make sure that they are building it to the code.
You know, this brings up there's a big debate in this country right now, and it falls along partisan lines, and it's kind of unfortunate. But this question of, is the cure worse than the disease when it comes to, you know, all of the guidelines and regulations that have been put into place to try and deal with health and safety? And I think, you know, we need to step back and ask that question of, not is the cure worse than the disease, but are some of the things that are being done that are purported to be the cure not actually helpful? You know, are restrictions on boating by yourself in a lake actually helping anything as far as blocking disease? And there's this concept, and it was applied to one of the licenses I have, where, you know, when I moved from Colorado to Arizona, thanks to the work of now Justice Bullock, I was able to waive in mostly, and the only class I had to take was on specific Arizona Constitution and Arizona criminal procedure, the things that were very different from the state that I had come from. So the restriction was narrowly tailored to what was different, right? And when we talk about some of these things like building codes that are different, the differences in building codes across states are going to be related to things like, tornadoes come through the Midwest, but maybe they don't come in on the coasts. If you're going to have those extra barriers, make sure they're tailored to solving the problem that you're trying to solve. And I think that may be a place both on the licensing side and on some of these other restrictions that are put in place to deal with the pandemic, where we can really start that dialogue and say, are we focused on the real health and safety issues, or are you trying to add something else to this because it's an emergency and you get to slide it in there?
I totally agree, and the means ends fit of regulations of any kind is something that's really important. The Institute for Justice has this great upside down pyramid of least restrictive regulations. It's my favorite wonder of the world. I'm not sure if it technically applies to that pyramid, but I like that one quite a bit. But I think one really shining example of this that I always use is with cosmetologists. They say, you're going to spread disease. You don't know what you're doing if you don't have a license generally outside the current pandemic.
They always say that. They always say that. Yeah.
But meanwhile, salons, for some reason, are just spreading tons of disease, and there's rampant infections. So the license isn't helping, and most of the license isn't even about health or safety. So maybe, just like Laura was saying, maybe it should be on government to have better health inspections. Maybe that would be the better solution, because what they're saying is necessary and working isn't. The license doesn't help the problem. So it's really important that we have a good means ends fit. And even if we think it is, it may not end up being that great. Another great example is with electricians. Mercatus had this study showing that in certain areas that licensed electricians, there was actually more harm because they cost more. So people took electrical work into their own hands and harmed themselves. So there's all these unintended consequences. And I don't blame governments for trying to fix a problem, but I do blame them for realizing that it's not fixing the problem and keeping it there, whether that's punishing people for isolating, but not in the exact way government wants to do it, or even when it's about the parking thing, where they're punishing them for not moving their cars. A lot of these, or mowing their lawns in near me, that was one of the issues where the locality is cracking down on people for not mowing their lawns. It's silly, but in so many cases, what government's purporting to do and what it's actually doing are such different things that we need to be good about calling it out, not just as libertarians, but just as hey, we want to protect health and safety, but this isn't doing it.
Yeah, here's the other piece. There was a great study that was released, and maybe you can help me, Shoshana. I've read so much lately. I think it was from Harvard, but about 2 or 3 months ago, where they said that they did this study and they found that people didn't really care. Consumers didn't care about licenses. What they cared about was, they had their phones, and they cared about what was on your Google, whatever. The reviews and the Yelp reviews and things like that. I think that, to be charitable, you can make the case, and we never like to be charitable, but I'll try to be charitable tonight. To be charitable, when some of these licenses were created, 30, 40 years ago, we didn't have the advantage of that. And so you can make the case, I suppose, that the legislators at the time were really trying to look out for the health and safety and welfare of the public. And what happens is you have some interest group that comes in and says, well, we need to be licensed because it's for the health and safety and welfare of the public. And, nobody wants to be against the health, safety, and welfare of the public as a politician. So they went ahead and they did that. Well, it's just not necessary anymore. I go to a haircut salon, and the first time I get a bad haircut, I'm not going back. The first time, if I walk in the door and I see that it's a mess, I'm not going to go back. People are not that stupid.
Yeah, no, I agree wholeheartedly. I have rainbow hair, and finding someone who knows how to bleach my hair right, I do the color myself, but the bleaching is actually really difficult to do if you're trying to do your own. But I had one person mess it up really badly, so I just didn't go there again. But I love that study, and I think one of the key points too is that it wasn't just about whether it's dealing with hair or something even like that. It was about construction and about contractors. So something that we always think, well, of course they should have their license, even though like contractors are licensed a million ways from Tuesday in different states. We might not need that if online reviews are showing that it's not great. The one part I'm sympathetic to is like registration, because there's all these things about like contractors skipping town after something. At least registration is a much lower barrier that's not going to get too much in the way. But you're exactly right. Like online reviews do a great deal. And I know that people had always mocked us for saying stuff like that, but now a really big study shows that like a Harvard professor wrote. I follow his work now. He keeps putting stuff out on it. It's been really good.
Yeah, I mean,
I've been known to wave. Sorry.
Go ahead.
Oh, I've been known to wave my cell phone at committee hearings and say, "Wait a second, we don't need these licenses," So.
Yeah, I mean, one of the things that is just so ridiculous. I was talking to a guy. He was up in Maine, and he gets his haircut at the same place. And when this first came through, they shut down the barbershop because the chairs were closer together than 6 feet. And he said, this is absolutely moronic, because all you could do is just tape off the chair in between two chairs, and then those chairs are more than 6 feet away. And this was early on, before barbershops were just shut down entirely. But this idea that if the problem is close physical proximity, why is there a total shutdown instead of a, hey, how can we solve the problem but still get the service done? And that kind of perspective, it's hard to do at a legislature. It's hard to do in a regulation. You have to have a little bit of common sense and a little bit of what's the minimum standard. But you bring up a good point, Shoshana, about the registration, where for some of these harms that people say are going to come from licensing, somebody's going to do a bad job on your contracting or skip town or take your money. That doesn't necessarily need to be licensed as much as maybe it's bonded, where there's an insurance policy that makes you whole if somebody breaks your house. I mean, have you seen anybody willing to do that, either Shoshana or Laura, where they're willing to think about other ways to solve the problem that maybe don't have as much of a regulatory burden?
I think people are considering that. I haven't seen any specific examples, but here in Nebraska, we get some pretty wild storms in the summertime, tornadoes and hailstorms and things like that. And whenever that happens, you have roofers and siding people come in, and so I agree with Shoshana that there is some level of it would be nice to have some level of confidence that this person is bonded. Most people whose houses are a mess, will look at whoever is paying, whoever's charging them the least amount, and they can get the money out of the insurance company. So, I mean, I think that there's something to be said for some registration, so that registration and show that you've that you're bonded, and have the Secretary of State give you a certificate that says registered and bonded with the state of Nebraska, and that should be plenty.
Yeah, and we at our street, we have an insurance scholar who knows far more about insurance than I ever hoped to. But insurance is one way around this, and there's also. Unfortunately, I just haven't seen a lot of openness to lower regulatory barriers. Everyone just likes to take the hammer. And if they're hesitant about the hammer, then they're a licensing reformer. So then we're already talking to them, and it's like, it's just preaching to the choir. But unfortunately, too few people realize that there's lower regulatory barriers, which is part of why I like IJ's pyramid so much, because bonding's on there, and there's other lower barriers, like health inspections, among others. But it's really frustrating because so many times when I have conversations with people, they haven't considered those lower barriers, and with legislation, usually they don't care to. Although honestly, one of my favorite examples of all time, my mom's a hippie, so I know about all different hippie stuff, and Oklahoma wanted to license Qigong practitioners, which is the ancient Chinese art of energy healing. My mom does it, so I'm like, Mom, you need to like fill me on what this exactly is. So and I looked into it. Even the local Qigong practitioners were like, why do we need to be licensed? And that's such a rare thing, whether you hear it from politicians or definitely industry people. It was a really interesting moment there, but that's honestly like the only example I can ever recall of an organized group saying like, no, lower barrier or no barrier, which is really frustrating.
Yeah.
Well, I mean, one of the things that I think medicine obviously is the first thing that you see in something like this, but we also have an issue of there's some food issues that are going to start coming up. You see them dumping milk in places. You see, packing plants shutting down because there's an infection that goes through the plant and it has to be reconfigured. What are the ways that you think we could apply this deregulatory or removing licenses and barriers to try and make sure that we don't have food insecurity problems as we move through this crisis?
The other day I was contacted by a fellow out in western Nebraska who's a rancher, and he raises cattle and hogs. And he said, can you get this message to the governor for me? So, well, I can try. I can tag him on a post. But his concern was, he said, they can't if they couldn't take stuff to the packing plants, how are they going to make sure that there was meat in the grocery stores? And the suggestion was, there are local butchers, meat packing plants, and so forth out in the western part of the state, but they can't sell directly to grocery stores because of state regulations. And so he said, why don't we waive those rules so that I can take my cattle to, Butcher X. Butcher X can, cut them up to the specifications of the local mom and pop's grocery store, and then they can, sell my meat, and they don't have to worry about the getting it through their normal supply chain. I don't know if the governor's going to bite on that or not.
There's so many examples of that in alcohol world too. I know it's a little bit less necessary, but
it's very necessary.
But there's so many regulations like that. Like I want to say it's Indiana. You can only sell warm beer at gas stations. Like all these silly things. In many cases, they've been waived, thankfully. But just as Laura was saying, there's just so many quirks in the regulations for supply chains. And it's just silly. And actually, it kind of goes back to one other thing I had worked on. One thing that I focused quite a bit on is just like government getting in the way of feeding the homeless. There's a lot of regulations throughout where, you have to have stuff inspected. When Bloomberg was mayor, he's like, no donating carbs. It's like, maybe we worry about them eating first. Like I'm a big into the keto thing, but I'm like, I'd rather eat than not. In Louisiana, a locality had burned a bunch of like deer meat. And we need to basically get those rules out of the way. There's so many rules like that. In Georgia, I think the prime example, Must Ministries has fed so many sandwiches to hungry kids, given them bagged lunches. And last year, the locality cracked down on them. Cobb County was like, oh, no, you have to go through this new inspection and all this stuff. And now Must is partnering with the local school district to make sure kids are having lunch. And they're giving out sandwiches, and they're doing the important work. More of that, more making sure that if there's a dumb regulation that those go away. Also even getting rid of like cottage food laws where you can't like pickle stuff or like or sell cookies out of your home. It's all silly. And if it's, if there's a genuine health or safety concern somewhere, maybe, but in so many of these cases, it's just anti-competitive. Food truck regulations have started to raise eyebrows at this time. Just it's unfortunate that like so many come to mind because it shouldn't be this hard to get food generally. And especially at a time like this, we should be making sure that those people can continue to work, that people can continue to take out alcohol with their food and stuff like that. Unfortunately, a lot of those regulations deal with localities rather than even states, or let alone the federal government. So identifying them and getting them out of the way can be a big pain.
Yeah, I think, what you see structurally is any business, any corporation, any profession that puts a lot of capital into either getting educated or building out a supply chain, building plants, they want to protect that investment, and they want to get the government to protect the investment for them. Back when we still flew on planes in the good old days, I met a rancher from Texas near the border, and he had beef cattle. And I said, where do you sell it? And he says, I only sell it by subscription. You have to buy a share, because there's no way without taking it to a federal facility that I could sell it to a store. Stores aren't allowed to buy it because that's a different part of the supply chain. And the large suppliers have put up barriers to force small producers to not be able to get in the supply chain. And I know that, Representative Massey has an act, the Prime Act, to try and loosen some of that stuff. But what happens is when you build these barriers, you build these structures that are based on how things work at a time, when everything gets shifted in a pandemic like this or any sort of disaster, there's no way to respond, because now you're trying to climb over these walls and these barriers in an emergency. It'd be like being stuck in a club with one door because you want it to be real secure. And then when there's a fire, there's only one door to get out. Do you think that those lessons are going to get learned as we come out of this, that we want to have more accessible ways in and less barrier to entry?
I haven't seen much talk as it comes to food, unfortunately. I'd like to say otherwise. And the lobbies are so strong. One thing I've been fighting over the past couple of years is I'm also vegetarian because I'm like the peakest person alive. But laws that stop veggie meat from calling itself veggie meat, cauliflower rice, or like almond milk. My favorite of those is the rice industry, because they're very mad at cauliflower rice. Meanwhile, they sell rice milk, which honestly is the most disgusting of the alternative milks. It's terrible. I drank it growing up and it is not good. So I don't know why they even care at that point. They should get rid of it and stop the hypocrisy. But it's something so silly, but it's spreading across the states. There have been national bills against this, with only Senator Mike Lee pushing back because he's awesome. But the fact that they're pinching every penny there and trying to stop every new market participant there, it's such a big fight against a lot of big food industries. And I think there needs to be more attention on how the regulations on food are hurting us at this time. But without more attention, I don't think people are going to really understand how exactly it's hurting people. And I think part of that might be because occupational licensing has become its own thing. Yeah.
I am also very mad at cauliflower.
No, I like cauliflower rice, just not rice milk. Cauliflower rice is fine.
It is not fine.
But
that is a lie.
But with food regulations, they're so scattered across all different parts of government, not only at different levels, but also different parts of each level of government. So I think just as a regulatory reformer, I think that might be part of why there hasn't been a broad focus on it as its own thing. But there definitely ought to be, so that we can maybe stave off some of these regulations in the future and reform some of the bad ones now.
I think that one of the things we also need to look at is as we become more self-sufficient, many of us live in communities, in cities where they don't allow you to do certain things. So in my town, it's crazy. In Lincoln, up the road, population, 280,000 or something like that, you can have, I think, 4 chickens in your yard. Okay, 4 hens. In Crete, Nebraska, population 7,000, you can have none. No livestock. No, and so I think that you're going to start seeing, and out in Kearney you can't have, or Grand Island, one of those you can't have any. So it's interesting it's interesting how, kind of random some of these rules are. And it'll also be interesting as, especially if the supply chain starts to break down a little bit, whether people start rebelling just a little bit and say, hey, enough is enough. It's time to let us be a little more self-reliant. I don't want to have a lot of chickens, but I wouldn't mind having a couple in my yard. I've got room, and I think there's a lot of people who feel like that. Of course, the mayor lives next door, so he probably wouldn't like that. So
yeah, well, and I think a lot of it is also, some of the supply chains are built for a certain way of living, right? The whole toilet paper crisis was really because people were going more at home, and there's a different kind of toilet paper they sell to, office buildings. A lot of the supply chain for food goes to the restaurant industry, and restaurants, can't stay open because they have to have these big dining rooms by regulation. If they were able to open just a kitchen with delivery, that's much lower capital costs, and maybe more restaurants would pop up. Maybe we end up with more restaurants, not less, if we're able to adapt. But if there are regulations in place that say you have to have a dining room of a particular size, or, 2 bathrooms or whatever, maybe it's time to take a look at some of that.
Yeah, and I'm sure that you guys have seen, but like in Los Angeles County, I think it was, they were preventing restaurants from selling like just grocery items, and I think they eventually reversed on it. But so some official there had said, "Oh, you just can't turn into a grocery," and it's like, I just like, oh, okay. So as long as you go through the process of like preparing the food, that's okay. But selling people the things you would use to prepare it isn't okay. It's ridiculous. And those kind of regulations not only hurt people who are trying to access those things, but the businesses. Like I know a record number of restaurants have had to close just because even with some flexibility, it's still been hard on them. And I imagine that where there's less flexibility, there's more restaurant closures. And it's all due to like this nonsense. For regulations like these, I'm not even sure what the point is or like who the lobbies are. In some cases, you're like, oh, I know who's lobbying for this. But in this case, it's like, is it the health inspector lobby or like what is happening here?
We were laughing in our office in an office call the other day. Our governor relieved some of those regulations so that restaurants can sell, if they've got eggs and milk and whatever that are already in containers, and they don't want them to go bad. They can also sell paper towels, toilet paper, that sort of thing. We were laughing that, okay, so you go through Burger King and you order, a Whopper and, 2 rolls of 2-ply or something. It could be an interesting dynamic, but certainly these places that can't be open right now, they've got a cash flow issue, and they don't want to have to close down. So anything that we can do to make it easier for them to operate, and why not into the future? I why not?
Yeah, I want to thank both of you, Laura and Shoshana, for coming on. This has been great. I think that's the great way to end it out, because this is not just about getting through this and surviving. It's about thriving on the other side. It's about what can we do to take advantage of this situation, to build a better world, a freer world as we go forward. So thank you so much for being on LPTV. It was great. 2 legendary legends of licensing reform.
Thanks so much for having us.
This has been another LPTV Town Hall. We come every Thursday evening at 7 p.m. Eastern to bring you some libertarian perspectives on issues that are in the news and things that we're facing to stay connected during this time. If you like these broadcasts, please support LPTV. It's what lets us do this. And don't forget to tune in tomorrow night. We're going to have LPTV Candidate Hour with Pat Ford at 8 p.m. Eastern. He has a surprise candidate. Details will be revealed tomorrow. As I've said, every time we have one of these town halls, we try and follow Mr. Rogers' advice, because he's a pretty smart dude. In a crisis, look for the helpers. Do what you can to help the helpers. Do what you can to reach out to people and ask them what you can do to help them. If you need help, talk to your neighbors, talk to your friends, talk to us. We can help each other, and we are much more powerful than any government, than any politician. all they're able to do is spend your money. Because we are people and individuals who know more about the situation, we can help each other. So be safe, be good to each other. Thank you for watching Libertarian Party TV, and we'll see you next week.